want to again thank the American Acupuncture Council for inviting me to continue hosting my show on their series To the Point. My name's Dr. Lauren Brown, and I'm the founder of Healthy Seminars, and I have my practice in Vancouver, BC, and I'm the author of Missing the Point, Why Acupuncturists Fail and What They Need to Know to Succeed. Our topic today is being laser focused on patient results. And I'm very excited. I'm going to give a thorough introduction to our guest today, which is Dr. Steve Liu. And we're going to talk about being laser focused on patient results. And you've probably heard me talk about this before, where I say to have a thriving, fulfilling practice where you're helping people and you have abundance in your life as well, yin and yang have to be in right relationship. And that yin and yang is your clinical results, your clinical skills. And then there's the practice management, your business skills. And many of you know I'm a chartered accountant, I'm a CPA, and I'm a doctor of Chinese medicine. And it's important to have those in balance. If they separate or they're out of balance and you have no practice management skills, even though you're the most skilled practitioner in the world, you may have no patients, so you're not really helping that many people. So my goal is for you to develop that practice skill. So with integrity, you're helping your patients, so you experience abundance and you help heal your community. When we talk about being laser focused for patient results, it's a pun, but we're actually going to talk about low-level laser therapy and how this can not only help with your clinical results, and that's why I've asked Dr. Steve Liu to come on with us, but also I'm going to share a little bit about the practice management of by adding that special added value in your clinic practice that you'll become more attractive to your patients. So let's introduce Dr. Steve Liu. He's not only a colleague, but he's become a friend of mine over the short period of time that I've gotten to know him. He is a licensed acupuncturist from Arizona. He used to be an electrical and laser engineer in the Silicon Valley. So he's been fantastic for me to talk to when I want to ask about the different lasers out there and how they work, because he's got that background. And he's combined low-level laser therapy, which the scientific community calls photobiomodulation, and what we call laser acupuncture in his acupuncture practice. So he's integrating the two, and he's been doing that since 2000. So he's had quite a few years since the year 2000 of combining this. So he's the perfect guest to have on our show. You should know that he is a member of the North American Association for Photobiomodulation Therapy since 2001, and he was its president from the years 2008 to 2010. So that's quite a feat as well for an acupuncturist to be head of that North American Laser Association. He also served as the president of the Arizona Society of Oriental Medicine and Acupuncture as well. And he's also served as a board member of the International Society for Medical Laser Applications. So you're starting to see that Steve is very involved in the communities and sits on boards because of his skill set and his knowledge. And he founded in 2006 the American Society for Laser Acupuncture, ASLAT. And in his practice, he treats many conditions. He's going to talk about some of the neuropathy, chronic pain, Alzheimer's disease, and Parkinson's disease as well. So let's bring Steve on, and I've got some questions for Steve. I want to let our audience know right away, Steve, these are the questions I'm going to ask you, right? So for those of you, why you want to pay attention, I'm going to ask Steve why laser acupuncture and regular acupuncture, why he sees it as a perfect marriage. I'm going to ask him what he's using it for in his practice, why are people attracted to his practice, and what is giving him better clinical results since he's doing the combination. And then we'll talk a little bit about ASLAT as well. So Steve, welcome to the Point. I'm so glad to see you again, my good friend. Let's dive into this. Why laser acupuncture and photobiomodulation, also known as low-level laser therapy, why do you think this is a perfect marriage for us acupuncturists?
Thank you, Lauren. Thank you again for the wonderful introduction. And my name is Steve Liu. Yes, I'm a laser acupuncturist. That's what I call myself now. I think there's a threefold why acupuncture and TCM will form a perfect marriage. And number one, we see a lot of older patients, and I always tell my older patients that we are not 20 years old anymore, including myself. So our healing rate is slow. So we, as you know, as an acupuncturist, we always try to convince patients that how to help heal faster, but then they are older. And so laser can literally help speed up that healing along with acupuncture treatment. And number two, some patients may be afraid of needles, so they are needle phobic, and kids, especially, and younger people or even older people. So you can use a laser acupuncture in place of the needles. And number three, I think is the most important part, is the when you see chronic pain, which is what we see all the time, it's very challenging, as you know, and because these are patients that came from, I call them medical rejects, because they're being rejected by the medical professionals, whether it's medical doctors or chiropractors, and so because they techniques they tried and didn't work for these patients, then they come to us as a last resort. And how are we going to heal these chronic pain? And laser is the one. Acupuncture get the healing started. We know that we can do that. And then once we got healing going, we need the laser to help speed it up. And I think that's the best part of that in this marriage.
Yeah, I think I've heard you call it, it's the great normalizer. And so you're finding that using the laser with your acupuncture, you're helping these older chronic patients' bodies behave more like they're younger or in acute stage. So you're getting those results.
Yes, I love that term, normalizer. That's why I use that too. Because when you have older patients, and how do you get this healing going, just like young people? And whether they are 60, 70, 80, 90 years old. I have my oldest patient now is a 95-year-old with chronic back pain, and she's walking around with pain, without pain. How I can do it? Because I normalize that healing, and with acupuncture using laser. So I love that word, Lawrence, the normalizer. The laser is the normalizer.
What are the conditions that you predominantly see in your practice? And I know there's many out, like I predominantly see gynecology, fertility, PCOS, endometriosis, and I'm using my acupuncture laser. You're doing a lot of other conditions outside of the fertility. Can you share kind of where your clinical experience is using the laser acupuncture along with acupuncture?
Yes, I love to talk about that, because laser, I always tell patients that laser photobiomodulation works on cellular levels. And what are not cells in our body is everything, right? So this laser work on muscles and tendons and soft tissue. That's what I really like to work on, because that's I see a lot of these cases in my clinic. But they also work on the nerve tissues, and which is very challenging for us, like a neuropathy. And I wrote an article for the Acupuncture Today a few months ago. That, to me, is one of the best technique we can have, is combining acupuncture, like a baffin and the toes, around the toes, but at the same time use the light right around the toes and balls of feet, because that's where the nerve has become dysfunctional, right? So this is why the nerves also work very well. Laser works on the mitochondria. So for instance, Parkinson's disease, sometimes the scientists call the mitochondrial dysfunction in the brain, even though it could be the substantia nigra, without they're not producing enough dopamine. But what if you shine the lights in the brain cell? And there's a tons of study for that. So why don't you combine that body acupuncture, scalp acupuncture, with light over the scalp, and it's wonderful combination that you can have. So this is why there's a unlimited, sky is the limit. Really, the sky is the limit when you're combining photobiomodulation, laser therapy with acupuncture. So this is why anything you can think about, you can use laser. So I don't have any pain case that without laser. It's always as a part of it. Electricity on the needles, and I always have laser around the needles, and I always have a heat over the needles. So I call it the whole enchilada. So this is why it's produce a wonderful, wonderful results, and that's how we can get referrals from your clients and from the doctors.
So I just kind of want to summarize that. You've been using it in your practice to help slow down the progression of Alzheimer's and Parkinson's disease. And you were sharing a little bit about the mechanism. It's outside the scope of our interview today to go into detail, but there's photobiomodulation that you're using in your practice. So you're using it as laser therapy. Then you're doing laser acupuncture, laser on the points, and then you're doing needle acupuncture. So that's kind of what you're doing. And the mechanism of photobiomodulation, the laser therapy, you talked about the mitochondria, the battery of the cells. And so if those batteries of the cells are repairing, they can divide better. So there's that healing response. And what we see with Alzheimer's and Parkinson's regulates inflammation. I mean, chronic systemic inflammation is becoming the cause of so many diseases. So if it can help with that, there goes reduction in pain, and then all these other disease processes, scar tissue and adhesions. So think of all those injuries with scars. And then you talked about the nerves, even nerve regeneration, and then blood flow, increases blood flow to the area. So that's why, when we've talked, you said it is the perfect marriage, right? And then the needle phobic patients, this just opens up your practice to everybody now, because there's probably close to 50% of the people that would want to see you as an acupuncturist, see you to get relief, but they can't come through your doors because their fear of needles is so bad. And so by doing non-needle acupuncture, you now open your door to other people. I often hear from our colleagues, that are just doing the needle that, oh, how can laser acupuncture work? Or is there research that it works? You and I both have access to the needle and the laser, and we love using both, and we love the laser. So that's why I like hearing from you, because you're not biased, because you have both. You're trained in both and you can use both, and you are choosing to use both. But can you share, is there research? What are you aware of about the research on laser acupuncture having an effect on the body, similar, or if there's any difference from needle acupuncture?
Thank you. And again, Lauren, you're such a good summarizer. Thank you. And when I first heard about laser acupuncture was from my mentor, Dr. Margaret Nazer in Boston. And then she published the first study on the carpal tunnel with the laser acupuncture. And you can look it up. And she was so excited when I first heard about her and got to know her. And she got so excited and then called me up, says, this is the first time AMA journal, American Medical Association journal, that actually published a study that contained words, acupuncture and laser acupuncture. So that was the first time I was just got blown away with what laser and laser acupuncture can do for something like a carpal tunnel. As you can see, it involves a median nerve. So what happened? And from there, I began researching more and more. There's a study that I run into a study that use auricular laser acupuncture, shine the laser lights on the acupuncture point in the ear to help quit smoking. And I love to see more studies, and I would love to do someday in the future that I can do on the quit smoking. I do acupuncture quit smoking myself. But when I come to like a pain, like a lower back pain and soft tissue injury pain, and I really have to combine acupuncture needles and the laser. Remember, laser is there to help lower the inflammation. We don't stop the inflammation. Inflammation is a part of a healing. That's how acupuncture helps. Because when we put needles into the tissues, guess what? We produce some low-level inflammation, and that's what we need. But lasers is there to help speed up that mechanism that got kick-started by the acupuncture. But when patients really have a problem with needles, for instance, you can use laser acupuncture in place of the need points. So you can use red lasers on the distal points, all these points on the fingers and the palms and the wrist. And then you can use infrared lasers on the body, like a stomach 36 and spleen 6 and so on, spleen 10. And it's deeper, because you want to target the nerves underneath the acupuncture point. So this is why we can combine laser and acupuncture, or laser acupuncture by itself. So this all can come together in the therapy.
And not all lasers are created equal. And so the wavelength matters. So the color of the light is going to matter about how it's going to affect the cell, the tissue, and how deep it's going to go. The power of the laser is going to affect the dosage of photons at the target tissue. So that's important, because how much time you need to keep the laser on the body. And so some of the lasers can be a large investment for acupuncturists. And this is why I love talking to you, because I know, Steve, that you've built lasers. Because remember, everybody, Steve is a doctor of Chinese medicine, and he's also an electrical and laser engineer. So he can look at a system. He actually helps some of the manufacturers improve on their systems, because he's got that skill set. I wanted to ask you a little bit that, first of all, not all lasers are created equal. So some lasers, although they're a couple $100, they're no different than using a PowerPoint light. You're not going to get any therapeutic value really on it. So still, you have to invest, it seems, to get a good laser. Personally, I want to share this story and then just talk about how you have found how this has helped your practice grow by having the lasers. And the story I want to share with you is my first laser I invested in was about $6,500, and I used it for on-site for IVF clinics, laser acupuncture, because a clinic had shown that it increased implantation rates by 15%. So that was a big investment, and that's what I used it for, but I wanted to get the results, help my patients. And it made our patients more attractive to our clinic as well, because we were offering this. And then I wanted to help with egg quality, and that required a different laser system, and help with endometriosis and polycystic ovarian syndrome, and engaging the relaxation. There's lots of things we can do with the laser. And so that system cost me $20,000. Now I got to share something with you that I was not expecting, but I understand why it helped. Because when you create value, the marketplace, your patients will seek you out. They will see you over other people. People get on planes pre-COVID to go to our clinic to be treated with our laser for fertility and PCOS. They'll drive an hour in my city to come to our clinic, even though there's many acupuncturists in their area, because they want a clinic that has the experience, the knowledge, and the good quality lasers to get them results. So here's the quick story, and then I'm curious, Steve, what your experience has been. When I introduced the laser for fertility in our clinic, several of the patients that I was treating, and let's just say they were being charged $95 back then for acupuncture only, and I would recommend twice a week. And many of them would say they couldn't afford twice a week, so they'd come once a week, or some of them said, I can't afford, and they did not come. When I introduced the laser, we increased the price of having acupuncture with the laser. And so we increased the price to say $140. So actually it was $130 back then. So $95 for acupuncture only, or $135 for both. And what we know, and it was 3 times a week, because we were following a group that had seen an improvement in pregnancy rates when they did the laser fertility approach 3 times a week in the follicular phase. And so we replicated that, and that's what we educated our patients. These patients that said they could not afford $95 once a week, or even twice a week, started coming in 3 times a week. So what I learned from that is it wasn't that they couldn't afford, it was that they didn't see the value in what I was doing in acupuncture, how I educated them to spend $95 a week or $95 twice a week. They just didn't see the value there. But when I shared how laser for fertility has the potential to improve egg quality and pregnancy rates, whether you're trying to conceive naturally or an IVF, and share some of the research, they then were willing to pay $130 3 times a week to get the results. So it was never always about the affordability. It was, is there enough value to pay that much money? So I wasn't expecting that, but that's what the laser has done in my practice. It has separated me from other clinics that are just doing acupuncture, because many of the patients are learning about this, getting educated, and they actually want the photobiomodulation with their acupuncture. What was your experience? Have you found that by what you're doing, and you have a FAST program, which you can introduce as well, because you're getting the results and you're using laser, has that also made your practice even that much more busier compared to before you added the laser?
Yes. I always say results. And as an acupuncturist, and as pretty much all the time, is the last resort, a practitioner that patients see you want to produce results. And to me, laser is probably the only way that when it's combined with acupuncture, really get the result. And because you heal, you really. And I know sometimes it's hard to say the word cure, but that's how it works. And so yes, it's a value added, because you can charge you $150 for acupuncture, but if you do not produce the results, it's still worthless. So, but if you add it in this, so in my practice, I combine laser and acupuncture with one fee. I don't have additional fee for laser. I consider it a value added, so that when I produce result, guess what? They're gonna see effect, within a few treatments. And guess what? And then when they were completely healed, and they're gonna refer all their friends and relatives and neighbors, and then the doctors begin to hear about your name, and they begin to refer their clients to you. So guess what? You get a lot busier practice. That's how I see it, and that's why it's a laser is a result driven. And I absolutely agree with you that Lauren is it's not. I don't think it's really the money. It's the result. When the patients see the result, when they see, they will pay for it.
Yeah, definitely. They want to get the results, and adding the laser helps give you that results. And they also, it's the education. Like, so when they understand, for whatever reason, I just, it's an observation. They understand photobiomodulation. It's more modern, it's more sciencey. And when you can see the mechanisms, they understand that, and they're willing to give it a go or give it a try. Where acupuncture, it's old, and they're questioning it. I'm not saying it doesn't
Right.
work. I use both, so it does work. And I have found
Right.
that it's something that has been attractive to patients. And I always say in my book, and when we talked at the beginning, we want to help them with integrity. So when you charge, because again, when you're making investments in $20,000 lasers and you only have so many, there's value there. So if you choose to charge more, you're doing it with integrity, because you've invested in more equipment, but your patients don't care about that. They don't care about your debt or how much it costs you. They care
Right.
about what kind of value they're going to get when they pay you. And so I've made that investment, and then patients are willing to invest in me because I have the tools to help them get the results.
Right.
I know in your practice, you have a program called FAST for chronic pain, right?
Yes.
And you often will help people in under 10 treatments get incredible
Yes.
relief from chronic pain, right? And so
Yes.
that makes you busy,
Yes.
but that FAST program requires laser in it, does it not?
Correct. Absolutely. It's the key. FAST. I came up with this idea is how to heal, and like again, a lot of times you can cure these chronic soft tissue problem like tennis elbow, golfer's elbows, and people come in and say, "I have these for 3 months. I have these for 3 years." Why? Because all the cortisones and all the anti-inflammatories and all this, they literally stop the healing. But the needles is there to help kickstart the healing. But how do you get this healing going in the better rate, quicker rate, like a youthful rate? When you were 20 years old, laser's there to help speed it up. And so laser is really the key, and to help. And so I can literally tell my patients that within 10 treatments you will be done, and then the pain's all gone, all completely relieved. So this is why, and I'm very proud of this program, FAST, and you can look it up. And I intend to bring it up in my conference with ASLAT, which is American Society for Laser Acupuncture Therapy, aslat.org. And we intend to have a conference later this year, and bring this FAST program, certification program out. And I'm working on that pretty much every day, try to figure out how to get this program together, and in modular structure. And Lauren and I are trying to figure out how to put this one together as well. So
Yeah, I'm looking forward to that. And so that website's important. So if you're looking for more information about laser acupuncture and photobiomodulation, that's the term that's replacing low-level laser therapy, is photobiomodulation and laser acupuncture. Check out the ASLAT website, because you'll see more information available there. And this is something that, again, I'm going to put the practice management twist on it, is when something is of value and people want it, then other people start to offer it. Just like acupuncture, it's not just trained acupuncturists that offer the acupuncture. Nurses do it, doctors do it, physios do it, chiropractors do it. I know in our profession, many acupuncturists don't like it that other people are doing acupuncture. But when something is effective, other people get it into their scope. With photobiomodulation, laser acupuncture, massage therapy are doing it, chiropractors are doing it, or physios are doing it. So it's out there. It's really big in Europe and more so in Australia, less so in North America and in Canada and the US, but it's great. It's gaining a momentum so quickly right now. And so this is me saying, learn about this, because it's going to be something that if your colleague has it or the physio has it, and if the physio can do acupuncture and laser and you only do acupuncture, as a public member, you're going to go to somebody that can do both. Like Steve said, one fee for both. Somebody's going to go see him versus somebody on the same street that can only do acupuncture. So this is my invitation that if you don't give this some attention, there's a possibility that you're going to miss out. And other modalities, other professions are going to have incorporated this. So I think it's important that acupuncturists incorporate it, especially the laser acupuncture part. And as Steve said at the beginning, it is a credible marriage. The practitioners that I talk to that are using photobiomodulation with their acupuncture never turn back. They love it. And again, my whole focus is on gynecology and fertility using the laser acupuncture with my needles. Steve, I want to thank you again for joining me today. Can you tell us a little bit about ASLAD? That's what we'll finish off here. But just tell us a little bit about the ASLAD organization that you have created and just what's available for acupuncturists on that website.
Yes, thank you, Lauren. ASLAD, again, stands for American Society for Laser Acupuncture Therapy. I came up with this idea back in 2006, and I reserved the domain name ASLAD because it's beautiful, it's nice and short, and I need to have this name reserved, obviously, a long time ago. But I haven't had a really chance to really get them going until last year, and then this is really the year 2022. Lauren and I gonna help bring this to the community. This is you can look it up, and there's a mission statement. I really want to use this as a community for acupuncturists. We are the acupuncturists. We're gonna own laser acupuncture, not any other like chiropractors or physio massage therapists. We are going to have it, and in order for us to integrate this tool into our practice, you guys need to, of course, be educated. And I love to be the educator, and also teach you how to select lasers devices, and what is technology, and what is LED, and what's the difference between laser and LEDs, and what are all these companies that are making all these devices, and what's the pro and con for all these devices, and so on. So this is a community I like to have, and then so it's all for us, the acupuncturists, and then so we can successfully integrate that into our practice and make like a Lauren. I know Lauren is very passionate to make us a good businessman as well, and it's important. It's yin and yang. We not only need to have a good skills, but we got to be a good businessman in order to thrive. Thank you.
You got to have those business skills. So it's not, so many people give it a negative connotation, and we're talking about, you just got to know how to run a practice. You got to know how to charge for things so you can keep your doors open, so you can keep treating your community. It's just really simple. It's math, and you can do it with integrity. And so that's why we talk about the laser therapy today, laser acupuncture. So ASLAD will have a conference, or has a conference, and there's information there. On healthyseminars.com, we have continuing education courses available for laser therapy. On our community library, we have many interviews with experts and researchers on laser acupuncture, Dr. Steve Liu being one, and is going to be offering many more. So do check out healthyseminars.com for the photobiomodulation laser acupuncture courses. All right, you've been listening to The Point with AAC, and tune in next week when Sam Collins comes in and joins us on the AAC To The Point show. I want to thank you, Dr. Steve Liu, and I want to thank you guys for tuning in today.